Hello, welcome. This is the Standing Committee on Health and Social Development, Wednesday, October 14th, 2020. And first thing, can I get an adoption for the agenda? Heath McDonald. Committee members here today, Tricia Altaz, Heath McDonald, Brad Trivers, Jamie Fox, and Hannah Bell. So we're going to receive a briefing about mental health and addiction since the pandemic. So I'll pass it over to our guest. She can introduce herself and can start with her presentation, and welcome.
Sure, thank you very much, Chair. Thank you everyone this morning. My name is Jennifer Ebert. I'm the commanding officer for the RCMP here in PEI. And I was asked to come in and speak about the impact of the pandemic on mental health and addictions in relation to from a policing context, both from those people that we serve, those islanders that we serve, as well as our own employees. I do have some statistics that are island-wide that encompass the 3 other police services as well. However, I won't get into any detail as far as what those may mean for those individual police services. But overall, over the past 3 years, so 2018-19, the percentage of calls for service when compared to the rest of the calls for service across the island have remained fairly consistent compared to what police get called for. So it ranges of the low of 3.82% in 2008 to 3.97% in 2019, whereas the total number of calls for service ranges around 3.83% for all calls for service island-wide in relation to policing services. And so as far as the RCMP goes, year over year compared to last year, a number of calls for service in the first 3 quarters are essentially the same, a difference of 0.13% difference, so really minimal. However, island-wide, there has been a decrease of 3.93% in the number of occurrences in the first 3 quarters of this year compared year over year. And really, one of the pieces of information that would be relevant for this committee is island-wide mental health calls for service have actually been down over the past 2 years. Island-wide 6.97% compared to the same period in 2019. Now that speaks to all police jurisdictions, so RCMP jurisdiction, Charlottetown jurisdiction, and Kensington all saw a decrease in mental health calls for service, whereas Summerside actually saw a slight increase. Now I can't speak to why Summerside over the 3 other jurisdictions, but in the RCMP jurisdiction alone, there's been a 13.85% reduction in mental health calls for service during the first 3 quarters of the year as compared to last year. Now, this number may seem contradictory to some of what we've heard in relation to the impact of the pandemic in relation to mental health, but it doesn't necessarily capture all of the data in relation to, this is mental health calls for service. And so how that data is captured is it a mental health call, primary call that comes in, or is it scored as a secondary factor to the call? So as an example is 10 impaired driving offenses, it was the secondary scoring. So the offense itself that we were called to was impaired driving, but in the instance of 10 of those, there was something that happened within that occurrence that spoke to mental health. And so although the numbers seem down, there does seem to be some nuances that exist in some other calls for service in relation to harassment or harassing communications. There was 8 instances in which mental health or addictions were the secondary source of those calls. And so it speaks to some of the underlying factors. And when some of our officers, because we ask for some input from them when they attend some of the calls for service, regardless of what it may be, it may simply be a neighbor dispute or something along those lines. Definitely there has been a higher level of agitation by individuals, as well as the description of, I would say, depression or those types of things, however, not to the level that it brings it to a mental health call. The one thing that has happened island-wide, especially in the RCMP jurisdiction, is impaired driving is up, and it's up dramatically. When you consider year over year the number of drivers that are normally on the roads on PEI, this year there's tens of thousands of less cars that are on the roads. However, we've already surpassed the 2018 number for impaired drivers on the roads. And so it speaks to some of the addictions issues that are out there. We've also seen an increase in seizures in relation to methamphetamine on the island. And you have to remember, for a certain period, up to the Atlantic bubble being open, there was some pretty significant restrictions in relation to what was coming on the island, yet we were still seeing some rather significant seizures. And so in relation to our calls for service, and the numbers are down, we have to consider the decrease in the number of people that are on the island at the same time. And so there has been an impact, but it's not real specific to just a mental health call. There's all sorts of other calls that happen. Before I proceed in relation to how it's impacted kind of policing, is there some questions about those statistics or anything that anybody would like me to clarify?
Committee, yeah. Okay, so I'll do Jamie Foxx and Hannah.
Thanks, Chair. For the benefit of the committee, Jennifer, can you explain how scoring actually happens as it pertains to Stats Canada and how that actually comes back down into the policing world? Because I don't think some people understand how that might correspond.
Sure. So how we gain our statistics is there's various lines of scoring. So whatever the primary offense is, or the primary reason that investigators would go to a call, that's considered the first line of scoring. And so that's where the mental health calls, there has been a reduction in numbers. But there's also several other lines that would fall underneath that, which is where we capture other data which is related to the call. And that's where we see was alcohol involved, was drug involved, is there a mental health aspect to these other calls? And so as we go down, then we can see where some of this other matters is related. And it's always the most serious offense that is at the top. And so in relation to our numbers, some of it gets captured anecdotally in the file in relation to how officers perceive a situation, but for the large majority of our statistics and what's captured by Statistics Canada, it would have to be in the scoring aspect of it, which is where these statistics do come from.
Jamie, okay. Hannah?
Thank you. So we'd heard anecdotally about the impaired driving numbers, and I know there's been quite a lot of conversation, in the space there, just about how the court docket is continually full of people facing those charges. We also see, or have heard again anecdotally, that they're relating as it relates to addictions, that this is repeat offence is one of those challenges. Do you have the stats on that aspect of it? Is it, like a first-time offence versus sort of repeat offenders for impaired driving?
I don't have the statistics in relation to that, but I can speak to there are a number of repeat offenders that we see, and it's not just the repeat offenders in relation to the impaired. It's a combination of a series of, so it's an impaired driver who already has a suspended license, who doesn't have a driver's license, and therefore has no insurance, and that seems to repeat itself. When one of those offenses repeats itself, it appears to repeat itself. But it is a significant problem island-wide in relation to impaired driving. And it's one of those, the more enforcement you put to it, the higher the numbers are going to go. However, just this past, so my statistics up to October the 1st were in RCMP jurisdiction alone, 185 charges of impaired driving on the island. Since October the 1st, there's been 7 additional charges. And so it's not a daily occurrence. However, it is significant. And anytime there is some sort of enforcement activity proactively, we're seeming to find an impaired driver. And these statistics include both drug and alcohol impaired, as well as clear refusals. They don't include when there's just a 24-hour suspension because the person has blown a warning, so they're not receiving a charge, but there's still alcohol or drug consumption that has occurred. And so those numbers, and we're seeing there isn't any clear demographic in relation to the impaireds. That it is across the board. It is everything from the L driver who isn't supposed to have anybody in the car with them or any alcohol, to the 65, 70-year-old fisherman, and to the school mom. It's everybody across the board, and some of these impaireds occur at 9, 10 o'clock in the morning as well. And so this isn't drinking in the morning. This is still impaired from the night before and individuals traveling to work. But it is a significant issue, and traffic-related matters tend to be the number one percentage of our calls for service on the island in relation to enforcement requests.
Hannah?
There's a lot to unpack in there, but I think there's 2 or 3 key things that I would take from that. One of them is that these are only the ones that you're catching. So this is not representative of the entire problem, but only the ones that happen to get caught. You answered my demographics question, which was about that scope and scale, which speaks to, being it's not something that is targeting, we've got a problem with young people or whatever, but it's that kind of piece. But one of the other things in there that you mentioned was that all the additional risks that come. This isn't about risk to an individual. This is about risk to the community, which we already know is one of those pieces. And the other one is in that case, is enforcement. What else do we need to add to our approach when the enforcement piece sort of isn't enough? Especially when you're also saying that, again, not only is it only the ones we catch, but that there's a whole chunk extra in there who are getting not officially on the books, but are still kind of making those poor choices. They're just getting that warning piece or whatever. So we've obviously got a tip of an iceberg kind of thing is what it sounds like to me. What are the pieces that we're missing?
So I think there's 2 contributing factors that come to that. There's the individuals who, when they're arrested for impaired driving, are 2-3 times the legal limit. And those are usually individuals who have addictions issues, who are, for the lack of a better term, functional alcoholics. And so the ability to address the root issue there, it's not the driving, it's the addictions issue, and they're always driving in that state. It's that constant state of impaired regardless of the time of the day. The other issue, which goes along with some of the other driving behavior on the island, is changing the perception that this is okay on the island. And so whether or not it be a car or an ATV or a snowmobile, this is constant on the island. And this year it's never been more apparent that it is islanders, not people from away, who are committing these offenses. There has been 9 traffic fatalities on the island already this year, and some of those were alcohol related. And so it speaks to just the perception of the drivers in relation to what it is that we're seeing. And it's not just the impaireds, it's the extraordinary excess speed that we see on the roads. And then when these things are combined together, that's where we end up with a fatality. And so addressing the addictions issue is one area that could use some more investment or discussion. However, it really comes back to driver behavior and the perception across the island that it is everybody's responsibility in relation to impaired driving, that you don't let your loved one leave. There was one incident recently in which an individual left a residence impaired, and it wasn't called until the police until after there was a collision. And so it's the responsibility of the individuals who are at that house, that is your loved one, to take the keys away, to not let that happen. And if there's a barrier to you preventing that person from leaving or driving, that you need to call it in, and we constantly get calls from the public about erratic drivers, but it's that, well, they only had 2 drinks or he only had 3 drinks, and we'll let them drive. And it's, I've been now on the island for 3 years, and it's ever increasing, I would suggest. And it's been more dramatic this year with the number of drivers that are on the road reduced, and we're still seeing the numbers.
Anna?
Thank you, Chair. I think a takeaway as well for committee is that we can't blame somebody else for this. Like you said, in some ways, COVID has given us an opportunity to be able to see this with a lot of those other layers of somebody else's problem taken away, as you said, and that's a really key piece. That it's not tourists, it's not visitors, it's not those people or those kids or whatever. It's everybody all the time, and it's us. And so that's a really important piece. And the fatalities, and I said there's been some, they're always tragic. There's never a good way or any way to go through those, but the fatalities have been, it almost feels like, oh no, this again. How can we be doing this again? And that kind of tragedy is something, when it's completely preventable, is really difficult to understand, how those things happen. So I really appreciate that around that personal responsibility. So, no, thank you. Thanks, Chair, for now.
Jamie?
Thanks, Chair. Thanks, Jennifer. This is a topic I'm very familiar with. And it seems like we've over the years, there's been a lot of different measures that have been put in place and tried, and I believe you're right. People are just not getting it, that it's not safe to drink and drive, and it is an addiction that some people don't understand, and there's consequences for that. Is there anything that you would recommend that as a province we should be looking at to help curb what is happening or what the police are being confronted by today and that families are facing?
I think that some of that comes back to the family responsibility in relation to whether it's youth or whether it's an adult in your family who's going to drive, and that communication around that. We can continue to enforce this issue. In this past year, we have had 2 dedicated provincial priority positions, which we have dedicated to traffic. And I can tell you that the work that they've been doing, there's no shortage of work on the island in relation to driver behavior in impaireds and excessive driving. And of course, the more enforcement, the more the stats go up, and our goal would be to enforce it to the point that the stats actually go down. However, we haven't seen a change in behavior, and although these individuals are out there, sorry, I saw someone with their hand up.
Oh, second me, yeah, sorry. Yeah, you keep going.
Okay, sorry.
Don't worry.
But it is both an enforcement as well as an education piece. But it's those individuals, whether it is an ATV run or a snowmobile run at those clubs where, they're serving alcohol and they're allowing people to leave. It is the responsibility of all islanders to, whether they're calling it in on a stranger who they see with erratic driving, or it is a family member or a loved one. And people don't want to get individuals in trouble, but I think everyone would agree they'd all rather have somebody end up with losing their license than losing their life. And so we have attempted to address it from an enforcement perspective. The fines and within the courts are pretty high compared to elsewhere in the country. In relation to excess speeding, that's a different issue, which they're looking at. My understanding is they're looking at addressing and changing some of those penalties. But I think it's a combination of both, the responsibility of enforcement as well as islanders and changing the fact that it's still seen as acceptable, and it's not an acceptable behavior.
Jamie?
How are there's a PTSD scope to this, because members, they go out, they do the best they can in their job, and sometimes they're seeing an effect that they're seeing something they're trying to stop increasing. So there is a mental effect on our officers and how they cope with it. How are they doing?
So last year out of all years has been a difficult year to be a police officer. There's been a number of challenges that have existed in relation to that. But it is that piece that, those officers are getting out there and they are attempting to prevent it. And Constable Duggins is now on the board of directors for MAD. And not only the individuals that we have in our provincial priority traffic unit, but others, they're dedicated to this. They're dedicated to making those changes. And so it does affect them when it just seems that nobody is listening. And impaired driving isn't only an island problem. It's a problem across Canada. It's a problem across North America. However, it's something that we can do something about it here on the island if we can just change that perception in the community that it's acceptable, whether it be at the hockey game, having a few beers and, getting in the car, those types of things. But definitely in relation to officers who continually deal with situations, it always does affect them. We do have critical incident stress debriefings that happen when there's a multiple person fatality this year. And, we have to follow up with our officers in that, because 80% of our employees are actually either from PEI or married to somebody from here. So they are islanders. And so it does have that effect. They do know somebody. And in relation to any traffic collision, and even in relation to the latest fatality that we had, traffic fatality that we had, is I spoke to some of the officers who had dealt with that individual before that, and it does affect them when they don't see lessons being learned as far as what that may look like. And unfortunately, when this year for a number of islanders, it has ended in a traffic fatality, whether alcohol related or not. A lot of they used to be called car accidents, and now they're called collisions, because there's nothing accidental about it, right? It's decisions that are made by that individual or another individual that led, totally preventable in most cases, that led to these incidents. So it's not really an accident.
Jamie?
Thanks, Chair. Final question is, is there any other jurisdictions out there, and I'm talking globally, that have implemented any measures that you're aware of or initiated new programs that we should be looking at as a province?
I can't think of one off the top of my head, because it is an ongoing issue in relation to everywhere across Canada. And people talk about increased fines, but it's until the mentality changes, is that fines are just on the back end. And we try to get that out there, that you're gonna lose your license, or it's going to impact you, down the road. But it's about the preventative piece. That's really the more important angle, and I don't know how to change that. Having been the victim of an impaired driver 19 years ago, while I was on duty, this is something that is I'm very passionate about. However, I don't know how to change that driver behavior, and I wish I did. Yeah.
Thank you, Chair.
Brad?
Thank you, Chair, and thank you for bringing these statistics forward to start off with, and giving us a chance to clarify them. And I believe in evidence-based decision-making, and I think understanding the statistics is really a good place to start, right? So I just want to make sure when it comes to mental health classifications on the incidents you're talking about, that we really understand what a mental health incident is. I'm not sure that I could give you an example, both in the primary classification or in a secondary. I was wondering if you can describe that, maybe give a couple of examples for a primary and secondary, just so we have a really good feeling of what it actually means to be classified as a mental health incident.
So it's really a broad area in relation to mental health. The mental health, a call underneath the Mental Health Act is usually dealing with somebody in a mental health crisis. Now that can be everything from an individual who calls to report they believe somebody is having a mental health crisis, and then officers need to intervene in relation to that situation. Or in a secondary case, so one of the examples that I have is a 911 call in which an individual who, from a mental health perspective, is having issues remembering certain things, called 911 accidentally. And so that would be like a secondary scoring, or somebody in relation to an impaired driving incident after they've been arrested in relation to an impaired driving incident, then talks about suicidal thoughts. And so it would be scored as so it depends on what you were called there for, what order. However, and that's why really mental health is very broad in the policing context, because we get called for a number of issues in relation to suicidal thoughts, which is a call underneath the Mental Health Act. We get calls to check up on individuals who are in crisis. And then there's situations when we're already there that mental health is an underlying factor to the incident that we are responding to. And so the calls, I'm just gonna confirm in relation to the methodology here. So Mental Health Act calls for service. So those are calls for service in which there has been that's the primary call for service is underneath the Mental Health Act. And so somebody's struggling, whether or not it's an assistance call to EMS or a care facility in relation to somebody who's struggling with mental health issues. They would attend and assist in relation to that file. And so it falls underneath the Mental Health Act.
Yeah. Brad?
Thanks, Chair. And that does help clarify, thank you. I mean, in particular, where we're speaking about mental health during the pandemic, really. And one of the items that's been brought forward a number of times that doesn't necessarily match up to the stats is the fact that, you know, families are in close proximity all the time, especially during the lockdown. And so, you know, if there's domestic violence, for example, the thought was that perhaps the stats had gone up on domestic violence. But whether that's due to mental health or not is what I'm trying to wrap my head around. So if you got a call for domestic violence, under what situations would that be classified as mental health, either as primary or secondary?
Usually in the case of a domestic violence call, unless it was clearly that somebody needed to be arrested underneath the Mental Health Act, that would be a secondary form of how it would get scored, I guess. But because it's not the primary reason why we're there, however, it may contribute to the actual incident itself, because domestic violence is considered more serious. In all of these calls, though, you know, when I was having this information compiled for you, I was actually surprised that we're not talking about in the RCMP jurisdiction, nearly a 14% reduction. And there wasn't any analysis that we could do that would explain the why. Because we all hear the anecdotal impacts of the pandemic on the mental health of people. However, when we're talking about the Mental Health Act, we're just not talking about individuals who are mildly depressed or just feel some anxiety. This is individuals who it has escalated to the point that the police have been called. And so it really only encapsulates a small band of those people who are suffering with mental health issues, because a large number of times they don't call unless they're in, unless they're in crisis, because mental health really shouldn't be with the police. And so those other those other services should be intervening at that lower level.
Brad?
Just to clarify one more time, so, for example, let's say there was domestic violence, but it was in the case, the children are involved, and maybe Child Protection Services was involved with that. That wouldn't necessarily be a call to the RCMP, and so you might not be involved with that at all, so that wouldn't be reflected in your stats?
No, it wouldn't be. So it's only in those cases that the RCMP has been called to assist underneath the Mental Health Act. So sometimes we're the primary responder, or sometimes we are there to assist Island EMS or another service provider due to an escalated incident involving mental health. And those are the only ones that are captured. So there's a number of services that provide services to those on the island suffering from a myriad of mental health concerns that the police are never involved in.
Just called for an intervention from Hannah about the domestic violence. She wants to speak on that for a second.
Yeah, and it's just a follow-up, I think, from Jennifer's comments, that domestic violence calls are not considered a mental health crisis, as that they are a different challenge, it would be, like you said, a secondary piece that would, a mental health call would come out from that. The primary responder for domestic violence are the non-profit organizations that provide immediate and direct interventions for somebody who needs to escape and leave their house, and ideally for somebody who is having to leave a domestic violence situation, they don't actually want to call the police because it will create an escalation, that puts the family in a very dangerous space. So we often wouldn't see domestic violence statistics reflected in police calls. The statistics should come from the service providers that do the direct intervention, and that would be Family Violence Prevention Services. And we've had them in different times in here, and I think I'd be very careful about conflating a conversation that we're having around mental health and addictions with an expert here and asking them to go into a space which is not necessarily a direct piece of their file. If we do want to talk about domestic violence, which I think we should, and its impact and the numbers that are coming out of that as it relates, then we should ask Family Violence Prevention Services to come in and do so, particularly in the context of COVID, because I think it would be really important for us to understand those impacts. I really appreciate the nuance there, but I also need to be very, very clear that domestic violence is not directly connected to a mental health issue. It's a very complex situation, and it can be as much direct connected to addictions, to mental health, to poverty, to a number of different pieces, and it's a different focus. So just an area of concern, Chair. And again, on a future work plan, it would be great for us to talk about maybe bringing that organisation in.
Definitely, perfect.
Okay.
Brad?
Well, thank you, Chair. And that's exactly my point, and that was the point I was trying to draw out, is that when we're talking about these stats here, we're talking about mental health issues underneath the Mental Health Act, and we're not talking about domestic violence necessarily. We're not talking about Child Protection Services or all those other great services that are provided sometimes by the non-profit organizations the member refers to. We are talking about real mental health situations, and so in this context, that's where I'm trying to understand, so we can make decisions as a committee why that would be down 14%.
Yeah.
And so I wanted to make sure that we weren't getting mixed up and including some of those others. So that was exactly my point. So thanks for making that for me.
Good discussion, committee. Heath?
Thank you, and thank you for the presentation. Yeah, the drinking and driving and drugs, it is flabbergasting. There's 5 on the weekend or 6 on the weekend. I think it was a long weekend. Is it the education component at the lower levels, say in schools? Is that, I know MAD's there, I've been a part of that, but I'm just wondering, is there something there that, because it's almost like a generation. We're starting to see I think it is, we're starting to see younger people drinking and driving more so than older people, I guess, and it's more young adults taking chances and risks, and it's just, you kind of wonder if, like, what are we doing wrong or what are we not doing? Just to kind of capitalize on that.
I don't have the statistics for the demographics of drinking and driving before me. However, I don't believe that there's any one demographic that's contributing to this. It's across the board because I've asked that question. But I do believe it is for lack of a better term, the culture on PEI that has allowed this to happen. If you have grown up watching a parent, a grandparent, an uncle, an aunt drive impaired, then you don't think it's a problem. And so until we can change that culture of acceptance, and don't get me wrong, Islanders call in all the time. However, there still is an issue in relation to the number of impaired drivers that are out there. And then there's a whole different category of driving behavior that would also go with that.
Heath?
Yeah, thank you. And I'm glad we clarified on the stats, because everything else in mental health seems to be going the other way as far as child protection and the fentanyl cases and so on and so forth. And it's all one big circle almost. It's almost like it's just a continuous of, and most of it, a lot of it can lead to mental health. Whether it's identified as an initial call or whatever, it just seems like there's a lot of stress and anxiety in society these days. And I guess, is there any, and I know you guys do a tremendous job, but is there anything that is being done well that could be even exploited even more, I guess, in your mind, what you see on the front lines?
So in most of these cases, we're the call of last resort. It has gotten to a crisis situation in which someone is suicidal, or in the case of certain individuals has committed suicide, or is in an absolute crisis. And there's been discussions around, attempted intervention through mobile mental health crisis and trying to intervene differently. And this has been a hot topic across the country in relation to mental health and the police. And I would say all of our officers would be more than happy never to respond to a mental health call again. However, unfortunately, until all of those fail-safes are in place in relation to services for individuals, that we're going to continue to respond to those, because mental health is a 24/7 issue. And there's a number of services island-wide that aren't available 24/7, or if you are on the North Cape or in a rural area, the services may not be equitable to those within Charlottetown or Summerside. I can't speak to, Summerside is the only jurisdiction that actually saw an increase. And I actually cannot speak to what that is. And when I looked at the stats per quarter this year, so in, where are we here? Sorry, I lost my train of thought here. In relation to our own mental health stats, in relation to the RCMP, is that we saw the biggest decrease between April and June. And so, the pandemic crisis, I'm not going to say started, but really began to impact people, mid-March. And so what I find interesting is that the biggest drop was actually in that April to June statistics. And so although it was overall within the RCMP jurisdiction, and I don't know if that has something to do with people being able to get outside and having a little more freedoms in relation to some of the restrictions that were occurring, but it is that compiling statistics in relation to the pandemic and other issues that people have been facing. The first quarter, January to March, was within 1 or 2 calls for service over previous years, whereas April to June varied 30 plus calls for service over previous years, which had remained fairly consistent over the previous 2 years. And then we're slightly lower in July to September than we were last year, but equal to what we would have been in 2018. And so I can't speak to what those individually contributing factors are. However, I do know that, from the officers on the front line, they see the stress in the people's faces. And so it may never be scored as a mental health file, and it may not be captured in these statistics as far as what that looks like. It may never be captured through data. It's just that anecdotal aspect of when the officers are having a conversation with somebody, they see it. And it's not something that we would capture on a file.
Heath?
Do you work alongside the mobile crisis unit here on PEI at all? Do you have any involvement in that, your officers?
So we, myself and the other chiefs of police are in discussions actually right now with Werner Ryan and that group who's trying to get some additional mobile mental health crisis here on the island and have specifically trained officers that would assist with that. And so we have been engaged with that proposal previously and still continue to be as far as advancing that. My previous service was out west in Alberta and Saskatchewan as well as the north, and I'm familiar with a variety of mobile mental health crisis teams that see a trained mental health crisis worker varied between nurses and social services and a trained officer responding to those types of calls. And that helps de-escalate the situation when it's not a uniformed officer that is attending. However, some of the calls for service that we have already escalated to such a high level that mobile mental health crisis team wouldn't be sent in until after the matter's been de-escalated due to the threat that exists. Yeah.
Heath?
It's a random question, but it's something that was brought to my attention with a family. It wasn't my family member, but a family member that had a family member that had PTSD or a mental illness, and very functionable and what have you, but has a lot of anxiety issues. And actually, she said to me, wouldn't it be nice if they could identify their mental illness, if they wanted, on their driver's license? So if they were ever pulled over by RCMP or city police, that they would identify saying, okay, the officer may have to adapt to the situation, something into that regard. I found that very interesting comment, but what's your thoughts on something like that? I mean, we do it for other things, identification on health related issues, and mental illness is obviously a health issue. So I'm just kind of wondering would that, and everything you're seeing around the world too, to identify someone that has PTSD, for example.
There are in other jurisdictions, and I don't have the information before me, but I'd be more than happy to gather it. In other jurisdictions, there are programs that have been looked at doing similar to what you've been talking about, similar to a medical alert bracelet that identifies that you suffer from a physical illness and I don't recall which program it is, but does exactly what you're talking about. And so it's a self-identifier that would go into call centers. And it may be something as simple as an individual is on the autism spectrum and is agitated by lights and sirens. And those types of things are captured. There are programs out there that have been utilized in other jurisdictions. I can't speak to the statistics or the success of those programs, but that is something that can be brought forward before this committee. And there is other digital platforms, I guess, is the best way to describe it, that information sharing can take place between agencies, as well as information that voluntarily people want to provide, because that is some of the information that is beneficial to officers when they're attempting to de-escalate a situation. And hopefully with the mobile mental health crisis proposal that they're working on right now through Werner Ryan's group, is that hopefully some of that information and that knowledge will be there in relation to certain individuals and what could assist an officer or a mental health crisis worker to deal with the situation so it doesn't need to escalate.
Trish?
Thank you, Chair. So you mentioned that in your previous work experience working with mobile health crisis response teams, that sometimes, if I understood correctly, that sometimes having a non-uniformed officer or someone come in from a mobile crisis unit can help de-escalate a situation that isn't too extreme, or that might be managed, de-escalate, I guess. So that, as we've talked about here, the mobile crisis response unit is still under development here in PEI. Very much looking forward to that moving forward. And I wonder, in your consultations with Verna Ryan and others working on this, is that does it seem like that will be an approach that's welcome here in PEI, do you think, where we can have perhaps situations where the mobile crisis unit would be able to respond perhaps without a uniformed police officer in some cases, and how would that work?
So I do think it's something that's welcome both from the policing perspective as well as from the mental health perspective, because any opportunity to early intervention to deal with and get the person the right help they need is really the goal of that mental health team. And the officers who would be involved in those teams would be identified and receive special training in relation to that. Now, all officers do receive mental health training. However, those officers would receive additional training. And from what I have seen in other areas, it is very helpful to a situation because certain individuals are already in an agitated state when the call comes in, and lights, sirens, cars, policemen, those types of things can agitate a situation. Sometimes they're necessary. However, these mobile teams can provide a service in there to those who don't need that level of response, don't need that police response. However, there still is an aspect of having the police officer there to ensure the safety of all individuals and all islanders, because the variance of the calls, and I think that's still being worked out as far as, okay, well, where's the line as far as when would this mobile crisis team be first on scene and when would they be second on scene, and those things need to be worked out. But I truly believe that it is a really good program. I've seen it work in other jurisdictions, and it does provide that wraparound service that isn't necessarily available 24/7 currently.
Trish?
Thank you, Chair. And what would be best practice then in terms of deciding, whether a mobile response unit would go in first or second, or is there a model where individuals could call and request that the mobile crisis unit respond to a situation if they felt more comfortable with that? What is the best practice for that?
So I'm not sure as far as what the best practice would be or what the standard operating procedures are. It's going to be different in every jurisdiction. Where I'm most familiar with mobile crisis being utilized is in larger urban centers, and so where that crisis team can be there quickly, where the response isn't delayed, and that does help de-escalate a situation. And able to get the individual's help. And so those are some things that we would need to work with the service providers here who are going to be involved as far as the level of risk of each call. And when somebody calls in, the information that is provided as to what the situation is. Mental Health Act calls for service can range from an incredibly violent individual who is not in touch with reality to an elderly person who is suicidal due to many other things. And so the threat level is incredibly different in each of those circumstances. And so that needs to be assessed as to who would respond and at what level the response would be.
Trish?
And you had stated that mental health calls for service have decreased overall, except for in Summerside. And I just wanted to clarify, is that just calls that are designated as primary mental health, or primary mental health is designated somewhere, whether it's primary, secondary?
So those are our primary mental health act
Okay.
calls, yeah. So, so island-wide, the volume of mental health act calls for PEI is down 6.97% compared to the same period in 2019. And calls for service, but we're still within the same band as the percentage of calls for service over the past 2018 mental health calls for service were 3.82%. In 2019, they were 3.97%, and this year they're 3.83%. And so very similar year over year, and relatively constant. And it's yet again, it's just those calls that the RCMPs and that police are being called to assist in relation to a mental health act case.
Trish?
Thank you. And do you have the numbers available for calls where mental health is listed as a factor, whether it's primary or secondary? I don't know how far you go down the list of factors that are tracked, but overall.
I don't have those calls because it could be a number of variances. But some of the examples of some of the ones that were given to me were impaired driving offenses where it was secondary, harassment and communications, those types of things where it was seen as an element as to the situation that existed. But the primary calls for service in relation to the Mental Health Act are down.
Trish?
Would it be possible to find out how many calls have mental health just as a factor? Obviously not today, but is that something that could be brought back? And if there's been any change in the number of calls that have that as a factor somewhere?
We can attempt to get those calls. However, you'll see the trend year over year, but I want to be cautious in the fact that it's not going to capture every call in which somebody is depressed or suffering from anxiety or anything. It's just information that is shared. Yeah.
Just
Trish?
one more
Yeah.
question, Chair. Thank you. And do you have a sense of what proportion of mental health calls result in an individual going to jail?
I don't have those statistics. If somebody's arrested underneath the Mental Health Act, they're taken to a mental health facility like the QEH to be assessed. And so there may be cases where individuals have committed an offense and they're taken to the hospital for an assessment due to behavior, and they may end up charged with a non-mental health related offense.
And sorry, just one follow-up to that. During the height of the pandemic, or the initial stage of the pandemic, we saw a decrease in inpatient services for mental health and addictions. Did that have any impact on your work at all, or more specifically, I guess, in the number of calls that might have resulted in someone going to jail instead of like a mental health and addictions facility? Did that change what was available to the RCMP?
I don't have those specific statistics, but the statistics up to the end of March in relation to Mental Health Act calls were over last year. We're down about 10 calls overall during January through March. And so it may be reflected in those numbers, but I don't have those exact nuances to provide you.
Thank you. That's all for now, Chair. Thank you.
If the start of COVID, if you were to go back and be handed a sheet of paper with the numbers about drinking and driving between the start of COVID and now, would you have been surprised?
I don't know if I would have been surprised because it's been an issue that has existed for a while here on the island. I am surprised that the numbers are going up. However, some of that is due to the fact that there's a lot less drivers currently on, in the last 6 months that have been on the island due to, restrictions of access to the island. We don't have tens of thousands of visitors driving all over the island. And so these numbers are and I don't have the percentage before me as far as how many vehicles are on the road at any given time. However, just when you drive around, you see the decrease, yet the numbers are over what they were in previous years. We've already exceeded the total for 2018, and we're likely probably going to exceed the total that were last year.
And when I look at this, we see these numbers, but the cold weather hasn't even hit yet, and that brings on a certain amount of seasonal depression, or better yet, in Prince Edward Island, it's Christmas time, and you know what that means. It's just more alcohol, more parties, more everything. Is that concerning for you, that the trend is so high and we haven't even gotten to, the I don't know what you call Christmas, you know what I mean, the difficult time of the year, I guess.
I think there's a number of celebrations which haven't occurred this year. Cavendish Beach Music Festival didn't occur this year. There's a number of special events, graduations, those types of things, weddings, all of those type of larger venues in which drinking is usually accompanied by them, or drug use for that matter. And so the lack of some of those events, because we usually, around Cavendish Beach Music Festival, for example, we have we usually beef up our response to that area because of, what can happen on the roads at those times. And so the fact that the numbers, yet again, due to the lack of some of these normal events and celebrations are down, and the number of overall individuals driving around the island are down, and the impaired driving is up, is concerning.
It is very concerning. So when you look at those numbers that came out of that, and I talk about like maybe gatherings or house parties, are those the source, or is that where most of people are going to these events and then leaving afterwards? Or do you know what I mean? Is that where they're coming from before they get?
There isn't one area or one demographic that we can point a finger at and say, this is youth, or this is university age kids, and this is, we can point a finger here. It is island-wide, all demographics, and at all times of day. There isn't one area that we can point to and say, here's the issue, and it would be a lot easier to fix if we could identify that.
So take the car out of it, alcohol becomes the problem.
Yes.
Jamie?
Thanks, Chair. One thing, I don't think I've missed this, but you provided a lot of information, but we're talking about impaired driving offenses that are up. Can you distinguish, is it impaired by drug or is it impaired by alcohol that's up?
The statistics I have are both, as well as in relation to refusals, because some individuals, the testing isn't done. And so the statistics I have are all encompassing. It's not broken down as far as which area.
Perfect. Jamie?
No, she just answered the last part.
Okay, perfect. This is, do you, I wasn't sure if you stopped in the middle, if you had anything else, or.
Well, when I was originally invited, they had asked about, the impacts on police officers and resources.
Yeah.
And so we have seen, so that's what I had some notes in relation to that.
Yeah.
And so there has been, just like everybody else, we have been impacted, and any essential worker or a critical worker, I would say the impact is there because the risk, although the risk to COVID on the island is reasonably low and has maintained that way, anybody working in any of the fields where you're having that constant contact with individuals and you can't maintain that 6 feet, it does elevate the risk. We have employees who I'm sure are no different than nurses and doctors who worried about taking it home to their families if they came in contact. And so some of that through proper PPE and discussions and the low rates on the island was able to be reduced. However, it still does affect individuals who are coming to work. And so at the beginning of the pandemic, because we provide a critical service, we had to think of a new way of doing things. Most of our frontline officers continued to do their job. It's something that we can't do differently. We can't work from home if you're a frontline officer, whereas some of our support staff, we were able to do that. However, the pressures on all islanders were no different than the pressures on RCMP employees in relation to when school, didn't exist and you're trying to homeschool your kids, right? Yet you're trying to still do your job. So really no different than any other islander, especially islanders that are in an essential service throughout the pandemic. Some of the nuances that did affect differently or some of our employees are those who were from away or those who were single, they would seem to be more adversely affected by the pandemic, and I'm sure this applies to other professions as well, because of the isolation that they felt. So when the Atlantic bubble opens up, everybody gets to see family. However, if you're from Saskatchewan, that's not the same thing. So those types of things did affect our resources, as well as there was pressures to providing policing services that we didn't anticipate or didn't expect, and so had to provide certain services that we'd never provided before. Border control is one of those areas that we exhausted extensive hours assisting the Chief Public Health Office in relation to ensuring those. And so until the data was there in relation to what that should look like, we continued to do that. And so using police officers to do that, and we can't hire a police officer overnight. And some of the other impacts of the pandemic, just even the movement of police officers and trying to bring individuals into PEI when you're dealing with, if you're a new officer to the division or to the province and you've got to self-isolate for 14 days before you come on a house hunting trip, and then you got to go back to Manitoba and you got to self-isolate there type of thing. And so it's nothing that is specific to police officers, but they too, them and their families were too affected. And there was one incident in which we knew our members, as well as some Charlottetown members, were exposed to an individual who was positive. And so that elevates the concern and the risk of employees. However, we've continued to ensure that our employees are supported through our various health and mental health programs, as well as ensuring that they have proper PPE, and that was one of the number one things in kind of reducing some of that anxiety around what is this, because nobody's ever done this before.
Interesting. Does anybody have any questions on that? Trish, yeah.
Thank you, Chair. Just going back to impaired driving, and you mentioned that proactive screening that you're finding that you can't have. I think you said something like you find at least one every time or something, that it's quite an effective way to unfortunately to find individuals who are driving impaired. Is there any sense of how many of the total impaired driving cases are found through proactive screening versus otherwise? Just curious.
So on the weekend there was some proactive. There's a Mad Canada check step that they did where they checked over 600 vehicles. There was a number of infractions that were given, and there was one impaired driver in that case and one person that was given a 24-hour suspension. Now proactive in those check stops is one way of doing it. However, watching for driver behavior is another proactive way, and I don't have the exact statistics as which we've received calls as to that's an erratic driver versus a police officer sees a behavior and says, now that's a problem. And so I don't have the statistics as to what, but it comes in all forms. However, usually every time we do some sort of check stop, there's an impaired driver who has been located. And so we try to do those as often as we can. However, we do have dedicated officers out there who are doing traffic enforcement, which is driver behavior is usually the number one telltale sign that there's an issue with the driving.
Okay, thank you. I was just curious about that. That's all.
I think this was an amazing presentation for our committee, and we're developing a report to the Legislative Assembly in November. So we'll definitely put some of this information in, and we want to thank you for coming in today. So what we'll do is we'll take a short 2-minute break, and then we'll come back and finish up the meeting. Thank you. We're back just to move on with the next part of our meeting. Moving on to number 4, which is new business. Brad?
Chair, so at the meeting the other day, we were talking about affordable housing, and in particular the affordable housing program. But I had raised questions about the down payment assistance program, and they said, oh, we can't talk about that, that's Department of Finance. And I don't recall if that's on our work plan or not. But if it's not on the work plan, I think that's the program that, you know, maybe is not as well known in the island as it should be. I think the member here from Cornwall was actually Minister of Finance, brought that in. It's good. It's a great program, and I would like to learn more about it, and not only how it can help with the housing situation on the island in general, but how, you know, it might even bode well for how would I say, bolstering the population in our rural areas.
Yeah. Open the floor to discussion on that. No, we're not. We're not on camera yet. No, we're in.
I just gotta think how I'm gonna say that. I gotta think of how I'm gonna say this. I'll tell you something I'm hearing around communities across the island, municipalities, is that there seems to be a push to do a lot of developments within our key core areas of Summerside and Charlottetown. And there's the real worry out there from municipalities that we should not be doing that because it's starving rural municipalities. And that we should be taking a look at developing housing projects in our rural communities and municipalities to ensure that they survive. Because what I'm hearing is that if we continue to build in the cities, which is good, but it's to a point, what happens to rural PEI? What happens to the little village of Crapo or the little village of Milton Vale or Darnley? We have one community right now that's only 15 to 20 minutes outside the city, and they're talking about dissolving. Because they're saying, why should we continue to be a rural municipality or try to have growth in these little areas when everything's going to the city? And there seems to be a drive by, I'm gonna say, certain individuals that are not looking at the context as the island or the whole island or other areas outside one area.
Well, thank you for that. I just want to make sure that, because this will open up a bigger discussion, but, so it started with the down payment program. So I just want to make sure that's the context, and then people can speak to both those big issues. Hannah?
Thank you, Chair. Just following on from colleagues' comments, what we heard from the presenters was that there was no plan for any coherent development because government is not the one that's doing the development. The development incentives are for developers, and it's up to the developers to decide where they can apply that incentive. It is not, there's no difference in the incentive that's available whether it's rural or urban. So the developers are making those choices, and we did hear that there were developments, they're very small ones, but there were developments actually primarily in rural areas, including Montague, Surrey, Tignish, Rustico, Cornwall, Alberton, and O'Leary. So, you know, they may be only 4 or 6 or 10 units, but there were actually significant developments across what would be rural locations. The core of it was that there isn't actually a plan from government to drive business or drive development specifically to rural areas, as far as we're aware. We certainly didn't hear it articulated during the presentation. And so, you know, one of the key asks was, what is the plan? So, you know, I think there's a bit of a gap there between the concern that's being raised by, you know, the honourable colleague, and the way the program itself is currently structured from a perspective of development. Certainly to the first question regarding, you know, the down payment program, it would be interesting to hear how that is working and what the feedback is in terms of the application process and what works and doesn't work in the context of home ownership. It's not necessarily a COVID impact to the same extent that affordable housing was, but it's still something that would be useful to hear.
Yeah.
But yeah, that was just the context for that you know, my takeaways from it, to follow up from those points raised.
Great, thank you very much. Brad?
I'd just like to put a request in the form of a motion that we write a letter to the Department of Finance asking for a summary of the down payment assistance program, and also perhaps an analysis of areas on the island that would support that would allow the purchase of land and building of homes for those working with lower income,
Okay.
you know?
Okay.
Does that make sense to everybody?
Chair?
Hannah?
Again, I think scope is a problem because the Department of Finance doesn't do any work with poverty or low income. It is literally a financing program, so they wouldn't have that data because it's not in their portfolio. And that in terms of development that are non-urban, then it also crosses over into the Department of Municipalities and the Department of Transportation, Infrastructure and Energy. And so I appreciate the ask, but I think you know, and I think we should go ahead, but the scope of anything to do with low income is not going to be in scope for the Department of Finance. It's not what they do. This is a financing program that is based on your credit score and your ability to take on a loan.
Okay, perfect. Trish and then Brad.
Yeah, I agree with my colleague. Just to add, perhaps we could ask where on the island, which areas of the island this program has been approved. So where have homes been purchased? Perhaps we can ask that. That might be interesting. But whether or not it's affordable for someone who's low income and how they designate that, or you know, it's not something they track, so we wouldn't be able to ask that information.
And Brad?
And Chair, I think perhaps I need to just rephrase what I'm talking about. This is a purely financial analysis. Like, it's going in and looking at the average price of land and homes in various areas across the island, which has nothing to do with other departments. Finance should be able to figure that out. And then looking at given different wages, like someone making minimum wage, also two people making minimum wage going up, then, you know, what threshold will allow them, you know, would they be able to purchase that land? What sort of loans would be needed? That sort of thing.
Okay, great. Trish?
So I don't think there's necessarily, you can't draw that direct line because there's so many other factors in whether or not someone could qualify for a mortgage, you know, whether or not they have a cosigner to support them in that. So I don't know that. Well, you might if you're a person who's lived low income for a very long time and has a lot of debt and wouldn't be able to access this program. I think what you're asking is beyond the scope of what the Department of Finance would be able to provide. Not to say we shouldn't be asking them for information. Perhaps we can ask if they track how many people have inquired about the program and either not applied or you know, have been turned down for this program for various reasons. We can certainly ask for that information, and we should, I think. Sure. But it's not a linear, you can't just draw that line between level of income and qualification for this program, because it's far more complex than that.
Brad?
Well, thank you, Chair. And that's exactly why I want the Department of Finance to talk about that, because, you know, I can sit here right now and I can go in and I can plug in the numbers and say, if I'm on minimum wage and I can get a loan through the down payment assistance program, then I can afford, especially if there's two people making minimum wage in a household, that I can afford $150,000, right? So the question is, you know, are there $150,000 homes available on the island? And if you go and do a search, the answer is yes. But I would like, you know, the official, you know, as opposed to me trying to plug numbers in the Google, just have the government department, you know, plug in those numbers, because I know that's the sort of work the Department of Finance does often. You know, they're kind of a central department that's vets spending by all areas of government, right? And so they do those sorts of calculations all the time to validate and verify the numbers that are coming in. And I think it's reasonable, but I do agree with the members that at the very least, we should find out all the details
Yeah.
about the down payment assistance program and, you know, the number of people who have applied, number of people that have been accepted, where they're located, all that kind of thing.
Thanks, Brad. Hannah?
Thank you, Chair. I would amend the motion to, or add to the motion, maybe a second letter, which should go to the provincial, the PEI Real Estate Association, who are actually more likely to be able to give us the current market availability and pricing in terms of, you know, literally what is the property availability across the province, what kind of pricing are we looking at, and that would be for land and single-family homes or homes of purchase. So if we could do that, I think that would probably be more accurate than what we can get from the Department of Finance. The second thing is that obviously we've got a special committee on poverty that's been working very diligently for over a year now, almost I think a year, into the nuances of poverty, and so I'm a bit dismayed that the fellow member is so thinks that a solution of sort of poor people should be able to buy houses is as simple as if you earn this much money you can buy a house. If it was that easy, I think we would have solved things a lot sooner. There are, as my colleague from Tyne Valley has said, many complex factors, including things like credit ratings, which Department of Finance is pretty fond of. So I'm really looking forward to hearing from the Department of Finance specifically about why, when they turn somebody down, what the reasons are and those barriers. And I think those two pieces of information together, availability and cost of the housing market from the industry association, and then information. But we are not going to get analysis of poverty and the reasons why people are in poverty and the reasons why they're not able to move out from the Department of Finance. We're going to get that from the Special Committee on Poverty and the work that we've been doing in that space. So again, if things were that easy, then these wouldn't be wicked problems. There's a reason why they're complicated, and I think this is part of the story to that. So if I could ask that we also do that second letter and make a motion to request that letter in addition to the one to the Department of Finance, I think that would be helpful.
Perfect. Thanks, Hannah. Brad?
Well, thank you, Chair, and I'm not opposed to that at all. I do think that this is not being put forward as a simplistic solution. I'm interested in finding a solution to this problem. I'm interested in making sure it happens, and I want to make sure we cover all the bases. And if this this is one that's not getting uptake for some reason, I want to verify what that is and find out why. It should be at least one tool in the toolbox that we understand in order to help people and eliminate that. So I think it's perfectly reasonable, and it's good to explore the solutions. Let's not explore the solution just because you know, you think it won't cover every single case. You know, and I really think you know, uptake could be improved if, you know, just simply more people knew about it, which I think is another role when you're at the standing committee and you bring up these topics. It does get a certain amount of press and coverage sometimes, and it can help promote the program. Also, maybe it's better to direct the letter to, as opposed to the Department of Finance. You know, the Department of Economic Growth, Tourism and Culture may play a role in developmental lending per se, as well as you might want to hear from the Department of Social Development and Housing, because they may want to input to that as well. But I guess I'm just trying to get an idea of how the down payment assistance program may be able to help with their housing problem. What does the uptake mean? How has it been working? If there are drawbacks, what are they? Why can't people qualify? Are there particular areas of the province where, you know, if people could move there, they would be more likely to qualify? These sorts of things. And maybe it is a multi-departmental sort of thing. Maybe it should be referred to the Special Committee on Poverty. I don't know, but I just think this is a tool that the committee deserves to know about and understand, you know, how much help it can have in you know, addressing our housing problem.
Yeah, we can make it. Perfect. Heath?
No, I'm just going to, really the letter should go, if you want to talk about developmental lending, you should go to Finance PEI. That's where the letter should be directed. So, and then under Finance PEI, you have innovation and IIDI, which actually do the groundwork for putting the files together for anybody that wants to access any developmental lending. So they may be able to come in and provide you with not just the low interest loans and things like that as far as the housing, but maybe even some of the other ones that we talked about as far as what products are available or being issued in O'Larry, Alberton, Summerside, so on and so forth. So they'd likely have a more rounded resulting conversation for us than Finance PEI.
Perfect. So maybe that's where we should direct the letter. Is that okay with everybody? Okay, perfect. And we might even use a side note too, is we might even take the minister's example and put 2 people on minimum wage and do some research and send it to a bank and see how much those people would qualify for, regardless of where they live, how much their threshold is. I'm sure we can get that information pretty easily. Yeah.
If I could jump in, since our meetings are all scheduled till the House opens, this could be something that we look at for the new year as kind of a jumping off point. Yeah.
And that's why I'm suggesting a letter, as opposed to try and schedule in a witness to come in, because I do know our schedule's full. So I just want to send a letter and then have them provide a written response. I'm not looking to have another witness added to the schedule.
Okay, great. So the clerk will have a little bit of work to do there, deciphering and probably looking. Do you want to ask any other questions?
So the original letter that Minister Trivers brought up, we want that not written to the Department of Finance. We want it to Finance PEI. Okay. And does anyone want me to read that back, or we all understand it? Okay, cool.
Okay, perfect.
Then I'm good.
Great. So all in favor of that motion? Say aye. Everyone? Yeah. Perfect. So motion passes. And to discuss about, to finish up about what you'd brought up, were you okay with how the conversation ended? Because, okay, perfect. Okay, so what we'll do now is we'll conclude the meeting, but we will move in camera for other business. So could I get a motion? Oh, sorry?
You need a motion.
We need a motion to go in camera. Jamie Fox? Okay, motion granted. Okay, thank you very much.